How has this initiative changed given the pandemic? We're not able to congregate the way we normally do. We're not able to communicate. And how has that made the very delicate steps of giving someone counsel and advising them and treating them for the various behavioral things that we may go through? But let's talk to the experts themselves. We have Helen Onadera and Alyssa Roberto. So, Helen, Hafaday, and good morning to you.
Good morning. Thank you for having us.
We're very happy to have you here. Helen is, of course, the project director and lead care coordinator, Alyssa Roberto. Alyssa, I'm sure that title gives you a heck of a lot of responsibility.
Oh, yes, it does.
Yeah, so basically your LinkedIn profile says, I'm someone who cares and I'm very compassionate about doing the best job I can for Guam. That's your LinkedIn profile right there.
Yeah.
Well, and very, very well deserved. So, we've been mentioning going all the way back to last year when we were talking about the Guam Crisis Hotline, which, by the way, everybody can find at 647-8833. Ladies, just about, what the volume of traffic was and the inbound calls to the line before. And I think they said it was maybe, 2 or 3 a day on a busy day. And last fall, because the situation was so tense, you guys were getting like 30 or 40 calls?
Yeah, it definitely increased since the pandemic. Yeah, the numbers have just been escalating. I think I was invited to talk about the hotline sometime last year, and was saying that it was the numbers did increase. And with every executive order, we do see the numbers increase a little bit more. I don't know what the numbers are recently, but I know that it's still been a steady flow. We, again, since the pandemic started, we continue to operate in crisis services. So we do provide crisis services 24/7. Project Tulaika is part of the crisis rotation. So we definitely see an influx in our intakes, as well as our hotline.
And I think that's maybe the one thing that people need to realize is even though, as we as a community battle COVID, I mean, it is obviously a physical disease and a virus. The mental health component to that doesn't exactly go away when you get the vaccine.
Yeah, exactly.
Yeah. So as subsequently, the volume of calls at your operations, or the number of jobs or the number of cases that you've had to do, may, if you were to chart it out, didn't exactly subside as quickly, if at all.
No, not at all.
Okay. Well, hey, we continue to pray for you guys, and again, we're a very grateful community, and we recognize the hard work and the devotion that you guys have shown. Can you maybe talk about some of the other services that Project Tulaika provides and how you've had to kind of shift those operationally?
I can talk about the services and how we've shifted during the pandemic. So prior to us entering this crisis stabilization service, we used to offer our care coordination just Monday 8 through 5, but we've been able to adjust, being able to telework, being able to be more accessible to our consumers, being able to use Zoom instead of just having them come to the department. We've been able to conduct intake and orientations over the phone. Again, as Helen mentioned, we have the crisis schedule ongoing. So consumers being able to call in or come in during 24 hours, we always have our frontline staff ready to assist. We have a partnership with Department of Public Health, where we wanted to increase access to services. So prior to the pandemic, we would be at the northern and southern regional community health centers, just 2 or 3 days out of the week. But now we've been able to attend our outreach we've been able to have outreach initiatives at the vaccination clinics, the testing sites, whether the testing sites are at the schools or any community venue. We've been able to be there, conduct screenings to see whether they would need further assistance with Guam behavioral health. And even with family meetings that we used to have, we've been able to work with families, possibly using mayor's offices to meet there, or using Zoom. So we definitely adjusted, we shifted, and we still want to continue offering services to our consumers, despite the heightened anxiety of, oh my gosh, I don't know if I feel comfortable going to the department. Well, that's okay. We're here virtually and we're so ready to serve you.
That's wonderful. Ladies, would you guys be able to maybe just maybe like classify like the number of requests or inquiries or cases to which you're assigned and everything like that? How are those being categorized right now in terms of the crisis that you're dealing with? Because I know, and again, Helen, you broke down for us like in staggering detail last year. Like of course, like law enforcement and social workers were really concerned about domestic violence possibly going up because everybody was locked in. Suicidal thoughts, like was a very big concern. So like, what are you guys seeing now in terms of the cases that you respond to?
We definitely see an influx of, it seems it's definitely a steady increase in acute cases. But Project Tulaika, we just had our annual or quarterly meeting in which our data is presented for the services that Project Tulaika does. And it was consistent that the majority of the youth and young adults that we work with are at increased experiencing depression and anxiety. And again, as Alyssa and her colleagues work with these youth and young adults, it is consistent with what we see nationally in that, the uncertainty of employment, the uncertainty of housing, the uncertainty of school. What does that look like? And so we're still getting our fair share of our work, and we're, and so that's why we were challenged to think of ways to continue to meet them in addressing their needs.
Yeah, I heard a couple weeks ago there was it's not an official case, but somebody just told me that they said one particular student was forced to do the virtual learning, and after maybe like 5 or 6 months, and everybody said all of his friends were this person was a model student, like always very energetic and positive, and like never had any signs of being morose or depressed or anything like that. And then because of having to stay in and not being able to get out and exercise, put on a few pounds and became extremely self-conscious and almost like frustrated and embarrassed and everything like that, and then began to suffer from like real serious depression because they were worried, when I get back and see my friends, am I going to be made fun of, or all the things that kids go through. And those are the kind of things, I never would have even considered going into like last year. And I'm sure you guys see this and so much more.
Yes, definitely.
I was talking with the director of the agency, with Jibwick, Therese Ariola, like a couple weeks ago, and I guess I'll pose the same question to you. It's with law enforcement, we tend to say in journalism, who polices the police. In your case, with responding to these cases, how do you maybe counsel each other, or like the people who work on these very sensitive, often very sensitive or very troubling cases? When you go home at the end of the day, how do you make sure that that you guys aren't becoming like so affected that you're not able to do your job?
That's a great question. It's self-care that's continually emphasized here. Even after doing an intake or having a session, it's a matter of consulting with our colleagues and say, hey, this, can we just like sit here and just take a deep breath and kind of just talk about what just happened? Making sure, I know a lot of us outside of our work, make it a priority to exercise. That is what has kept most of us, feeling safe during this time. Also, when we do, part of our protocol is when we do go out into the community to respond to a community crisis, we do have some people who weren't part of the team who are on standby to provide that debriefing for us. Our hotline workers, we have staff to also provide debriefing after an intense call. So it happens inside inside the building, and it also happens outside when we go home. That's one thing we always emphasize to our team is, the work will always be there. But when you go home, unplug, even if it means not responding to your messages as soon as possible, just take a breath of fresh air. But that is very important. I think that's what kept me going, was knowing how to do that every once in a while and check in with myself.
Yeah. I really do want to commend our overall Ghibli team. We really do have a strong family, very strong family sense of, uh, how do you say it? We're just like a big family here. We always check in with each other, regardless if we're Tulaika, we have Project Link, we have our counseling division and community support. We all just collaborate with each other, check in, and we just keep a really good momentum going to ensure that we provide the quality services to our consumers, because we have to check in and make sure that we're able to provide provide services to everybody. So I'm really grateful that we have a strong team here, and I really look forward to how we're going to navigate going back to this new normal that we have. But yeah, we really do check in with each other, and it really gives a lightened load on my shoulders knowing that we have a team that cares for each other.
Well,
I think that was the silver
absolutely
lining.
agree anecdotally about like the fact that you guys are a family environment, because one of my first cousins was a behavioral health for quite a long time, and she's now moving to CPS, and she said it was a very tough decision to make.
Yeah, that's the silver lining in the crisis services. Again, when we put everyone together in one mass rotation, it wasn't Ifema and Project Tulaika. We weren't like separate. We all became part of this overall, like, all right, let's help the community. And so we did foster relationships, met new people, or met people who've always been here, but we never had the time to make relationship outside our four walls, right? Within each division. And so, through this pandemic, I think just being able to rely on each other and pull through and pull our weight has helped us a lot, has made the process a lot easier.
All right. Well, I like how you use the word time, and that kind of is the operative word, because I wish I could give you as much as you need, but unfortunately we are running out of it as the top of the hour is about 9 minutes away. So I'd like to give you guys, parting shots and final thoughts about what Project Tulaika's commitment is, and how even though pandemic has made things weird, certainly your commitment to providing that quality care that people really need, even when they maybe don't realize it or don't want to ask for it, that has not wavered one iota.
Yeah, no, Project Tulaika is here. We continue to be here. And like we said, even though we are not able, we do have, we can do face-to-face by appointments, but we are also providing telehealth services via video conference. And I think just to end, I think we just wanted to highlight several of our May mental health activities. So today, I think it's, I don't think there's any more room, but we have our stress management virtual training that's going on today. Just kind of wanted to give a shout out to that. Tomorrow we do have the lunch hour with Peace, and that's via Zoom. That's at 12 p.m. And then the ones we're looking forward to is this Friday, the Kite Festival, which is at the Adelup, the Governor's Complex from
I'm really looking forward to that.
6:30. Yeah.
I know there is an ongoing art competition. So if you guys can stay in touch with our social marketing outlets, I know that we're on Facebook and Instagram. So if you guys can check into those and be updated on the latest news on how to engage with these outreach initiatives, it would be great for the community to come out and support and just continue increasing awareness about mental health and how we can all come together as a community.
All right, ladies, thank you so much. Please stay strong. Keep doing what you're doing, because we as a community are better off for it. So thank you for your time.
Thank you.
All right, please stay tuned, everybody. We got Cover Me coming up.